Let's move on finally to Ms. Kassoon, or Kassoon. You'll have to correct my pronunciation. Please, you have 2 minutes, and please introduce yourself.
Hi, Chairman and committee members. I am Dr. Carrie Kassoon. I'm a pharmacist by training. And here's why I'm testifying today: to honor Lexi, the young 18-year-old woman who died on February 6th after being transported to the hospital from Fort Collins Planned Parenthood. I only learned of her death last Wednesday when a family member reached out to me. She is relation to one of my family members, and they sought to get answers, greatly wanting answers regarding amniotic fluid embolism in the context of abortion. Lexi's grandparents described her as kind, caring, and very responsible young woman. She had just actually moved out into her own apartment and found out within a few weeks of that she was around 22 weeks pregnant. She found this out through seeking care for a urinary tract infection a couple weeks prior. Lexi's grandparents were called to the hospital on February 6th. This is the first time they learned of Lexi's pregnancy. The grandfather shared with me the hospital experience. I could see the heroic efforts the doctors were doing to save her life. And he could see the deep concern in their faces that the situation was very dire. Her vitals were all over the place. The oxygen levels were horrible. After multiple doses of epi and 7 liters of blood, his granddaughter's blood pressure dropped, or heart rate and blood pressure dropped. And he's seen in his granddaughter's face that it was her end. The complication of abortion was amniotic fluid embolism, and she developed disseminated intravascular coagulation as a result. She did not come in with this. He and his wife were devastated over the loss of their grandchild and their great-grandchild that day. Amniotic fluid embolism is a life-threatening obstetric complication following abortion or delivery. Gestational age is a risk factor for abortion-related amniotic fluid embolism.
Thank you very much, Doctor. We appreciate your testimony. Folks, we have 4 witnesses. What questions do we have? Rep. Garcia-Sander.
Thank you, Mr. Chair. This is a question for Dr. Wheeler. How did you become interested in patient safety with regard to abortion in first, second, and third trimesters?
Dr. Wheeler.
Thank you, Mr. Chair, and thank you for the question. I, early in my practice in the 1990s, I did full spectrum care and was doing abortions at the time, but in non-abortion related procedures, I personally in first trimester had a couple incidents where I actually perforated the uterus, but I was in a facility that I could immediately manage it. And so I became very interested in how do I decrease my personal risk of complications. It was around the time that To Err Is Human came out from the Institute of Medicine, revealing that actually you're more likely to die in a hospital than you are in a car accident or from breast cancer if you're a woman. And so there was this whole focus on how do we make safer systems, and a lot of it is policies, it's inspection, it's in data collection and evaluation when things go wrong to improve systems. And so I've become very interested in that and actually gave grand rounds on it. So that's been very important to me.
Thank you very much. I appreciate that. Let's see, we had Rep. Bradley. Let's go to Rep. Bradley.
Thank you, Mr. Chair. Thank you, Dr. Wheeler. The death of Lexi, and God bless, she died in what I'm assuming is an unregulated ambulatory center. So with risks like this, why wouldn't we regulate this industry if all other ambulatory clinics are regulated? I just love your opinion. And would Lexi have been saved had she been in a different situation?
Sorry, who was that to? Sorry,
Dr. Wheeler.
Dr. Wheeler, go ahead, please.
Thank you, Mr. Chair, and thank you for the question. You know, it's hard to know without knowing all of the medical information. Amniotic fluid embolus, it's a clinical situation. It may be confirmed by autopsy, but typically the woman just out of the blue has incredible anxiety. She may say, I feel like I'm dying, become incredibly short of breath, become immediately hypoxic, low oxygen. Her blood pressure may drop out. And it's a true emergency. Half of the women will die within an hour. And in that situation, you've got, other things like this can happen in obstetrics, which is why we're talking obstetrics. So we should be regulating and making sure there are emergency protocols, that the staff is well trained, that it's a multidisciplinary approach to obstetrical emergencies, because we care about maternal mortality. So I don't know if she would have been saved. I'm not sure this is really an amniotic fluid embolus. I don't have the records. Part of the syndrome can be DIC, which usually you see as acute hemorrhage that you may not be able to stop. And that's part of the syndrome. So I don't know for sure what this actually was, but she would have been more likely to have been saved if there were good protocols, good transfer protocols, that with escalation of her illness, that if she was immediately transported to a hospital, her chance of being saved may have been higher.
Thank you, Dr. Wheeler. Let's see, back to Rep. Bradley.
Thank you, Mr. Chair. To Dr. Carey, I think it was Nassam. Could you just finish what you were going to say?
Dr. Casson.
Sorry.
Where would you like, in terms of the rest of my testimony?
Yes, please.
Dr. Casson.
Yes. Can you hear me?
Yes, we
Yes,
can. Go ahead.
I think I left off in the treatment requires prompt recognition, triggering immediate evacuation of the fetus or the product of conception, aggressive maternal cardiopulmonary support, fluid administration, vasopressors, inotropic support, and even phosphodiesterase inhibitors to optimize right ventricular function. So Lexi's grandfather was told by the abortion providers that Lexi was transferred too late. She didn't receive the urgency of care that would be required in order to have a chance to survive this condition. Instead, she got the silent siren treatment.